I chose this picture to show you the empty open space in the base of your pelvis with a view from the front and above. There are no bony structures there to prevent your internal organs from pushing through that hole. It isn't actually empty. This picture shows the network of pelvic floor muscles that fill in that space. These are responsible for providing resistance to the weight of your internal organs. They act like a trampoline. These muscles are anchored to movable parts. The movable parts I want to call your attention to are the sacrum and tailbone at the back, the pubic bones at the front, separated by a small bit of cartilage, and the large bones of the upper legs, the femurs, on each side. When these parts move out of alignment, it weakens the integrity of the pelvic floor muscles, and they become more like a hammock. Let me give more detail. The lower diagram represents a view of the pelvis from the side, showing the sacrum, tailbone, pelvic floor, and pubic bone. This posture demonstrates a tucked tailbone. This can result from spending the majority of our time sitting. The effect is to move the tailbone forward toward the pubic bone. This weakens the integrity of the pelvic floor from back to front, allowing it to sag. The same can happen when the bones of the upper legs are misaligned. When the femurs are in alignment, the knees point straight forward and are supported by the tone of the inner and outer thigh muscles. However, due to the number of hours we spend in a seated position and walking with our feet turned out, the inner and outer tone of the thigh muscles diminishes, and the legs have a pattern of internal rotation, causing further sag in the pelvic floor from one side to the other. The unfortunate results of this contribute to increased clenching of the sphincters. In men, the urethral and anal sphincters. In women, the urethral, anal, and vaginal sphincters. It is an effort to resist the weight of the internal organs downward. These sphincters become fatigued and will eventually fail with either of the following consequences. In women, it's called uterine prolapse. The uterus actually comes outside of the vagina. In men, there is no opening, but the weight of the internal organs press down on the prostate, creating friction and heat because it has nowhere to go. This denatures the cells and creates prostate disease. I can't emphasize strongly enough the importance of changing these habits of misalignment and learning to walk, stand, and squat with an untucked tailbone and externally rotated femurs. Our bodies are capable of supporting healthy alignment, and that is highly preferable than dependency on prescription pain medications, surgery, and disease.